This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and welcome to the Healthy Hour. That's what we do for the next hour. Do our best to get you as healthy as possible. That's why we call it Health Watch. Nice to have you with us. As always, every Sunday, 8 till 9, Talk Radio 1210, WPHT. 855-839-1210 is the number here if you have a question at any time during the course of the show for the one and only Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. Well, you are the one and only. There is no other Dr. Molly Fantasia, right? And if there was, she's an imposter. Okay?
Well, I don't know. They keep saying there's several Dr. Mollys now. I said, yeah, well, that may be true, but there's only one Dr. Molly Fantasia.
That's right. That's right. Well, we're going to talk about a lot of things today related to not just, I know you're tired of it, and so are we, but
so are we.
We're going to talk about COVID-19 and testing information, and we'll talk about some new patients and some things that may be on your mind. That's why we tell you, call in, 855-839-1210. Dr. Molly, we normally start with kind of like an overview of what Innovative Medical Associates is. So let's just briefly, because we're going to get to this COVID thing.
I do.
Briefly tell us, Innovative Medical is what? So
Innovative Medical is a collective of healthcare providers who've come together to, in my facility, a primary care facility, to treat patients, and they are able to treat because they're physicians and nurses, registered nurses, and they follow the doc's orders. So we can do anything any primary care facility can do. You go into an urgent care, you bet we're just like that. Actually, we're better. So the bottom line is, but it's our philosophy that really separates us from everybody else. We believe, yes, if you need an antibiotic, if you need an antiviral, we'll be able to prescribe it. But we'd like to augment that with hydration and the delivery of natural products.
And when you get the hydration, what is in the hydration?
Vitamins, minerals, amino acids. And the reason why I love hydration is because we're able to get to the therapeutic level more quickly than if you ingest them orally. I'm not saying that ingesting your vitamins and your minerals, etc., is bad, but you just can't get to that therapeutic level too quickly.
Okay, tell us the difference. You've done this before.
Yeah.
Tell us the difference between, let's just say,
vitamin C.
Vitamin C.
Okay.
All right, I take 1,000 a day.
Forget about it.
Okay.
That's a drop in the ocean, okay? And yes, it's good that you're maintaining 1,000 a day because why? You come in twice a week for a big dose.
Right.
So you're maintaining the reserve. And then I'm going to hear the naysayers tell me, especially the scientists and the docs, well, that's all water soluble and they're going to excrete it out. The answer is yeah. Okay, but at the level that we're able to deliver this for a patient, assuming that they're able to take the hydration and that they don't have a hemolytic anemia, several of the things I check for, right? We are able to deliver a dose that is appropriate for them to effectuate the change, make them have a better quality of life, and then we want you to take your orals while you're away from us.
Yeah. Just explain for a moment. You said something, and it made me think. The naysayers say excrete it out.
Yeah.
But you've always talked about reserve. You don't excrete it all out.
No.
Some is still in there, right?
Okay. That's exactly right, which is why when you take the 1,000, you probably are excreting that all out.
Right.
What we're doing is getting it to the tissue. We're saturating the tissues that we know are involved with certain challenges that you may have. And that is the key to what we're doing.
And you do this with not just vitamin C, but you do this with other
nutraceuticals.
Okay.
You know that, John. And we're going to do a specific nutraceutical, let's say, hydration for a specific patient to really answer whatever the patient comes in with, whatever challenges they have.
All right, 855-839-1210 is our number here. And again, it's Health Watch every Sunday, 8 till 9, Talk Radio 1210 WPHT. Everybody's talking about it. And speaking of testing, Everybody's talking
COVID.
about COVID testing.
Right.
Now you test, but
Of course. But we are not a testing site, all right?
Right.
We have a CLIA license. Don't misunderstand me. You know, Dr. Molly comes from that background. But we're testing our patients. We are testing our staff. In fact, our staff is tested weekly. So what I'm trying to do, and thank God we've been doing it very well because, you know, I'm cleaning the facility, et cetera, et cetera. So, yes, we test. Now, there's been a question about what type of testing is out there. Well, everyone knows that the gold standard of testing is something called the genetic testing, PCR. That's done with a nasal swab. Generally, that is not a quick test. It may take a couple hours to a couple days to come back. And we have the ability to send out for that. We actually have a contract with a really good lab right here in New Jersey who understands that this is exceedingly important in
Yes.
the tri-state area, okay? But I also have bench tests, I like to call them. One of the things that separates my test is I didn't jump on the bandwagon when everybody else did and said that they wanted the same test that all the papers were calling wonderful. I can't mention the
Right.
particular manufacturer because they'll come and beat me, but everybody knows which one that was. That was the first one out. Everybody wanted, but we had some challenges with that. Well, Dr. Molly did a little more research, and she got herself a bench test that actually is doing something a little different. We are looking for antigen, not just antibody. Now, you got that, John?
Yes.
Antigen. So now I'm going to have somebody tell me, well, what the heck is the antigen? Well, the antigen is present the antigen is the substance that the body makes when the virus itself is present. So that starts the antibody cascade, which
Okay.
is the big buzzword everybody's talking about. So the antigen testing is pretty darn good, meaning it's got an actual statistical analysis. And by the way, I don't always go by the statistics, but it really has a good statistical analysis that correlates with the clinical relevance. So I look at that and I say, wow, that's a great test. So we're looking for the antigen, all right? Now, I also have a test that can do antibodies, which is the one mostly you're hearing right now. And we have two, so they're both rapid tests, by the way. 15 minutes, relatively. You know, there's prep time and stuff. So the antibody test tells us if you have an IgM antibody, you've been recently exposed to the infection and the body's fighting it, right? And it's doing that right now. Well, would you think maybe an antigen was present prior to that? The answer is yes. Now, I'm keeping it simple. This is a biochemistry test that I don't want anybody to fail. All right?
Okay.
All right. So, yes. That's a good indication that you may have a recently exposed infection. Now, there's also IgG. That says that they may have had a previous type infection, right? So, this type of thing tells us where you are in the continuum of this COVID. But my point is the antigen test for a bench test is probably a gold standard test.
I was just going to say, what's the best one? And if
From
you're,
that perspective.
Okay.
But the very best one is what? It's what we have to do by sending out for the PCR test.
all right, if somebody is going to get tested, does it matter for them to ask the person testing them what kind of test am I getting, or you just get whatever they're giving you?
Well, that's the point. The point is most people don't know what they're getting. So again, the IgM, the antibodies are exposed and present, right?
Yes.
The IgGs are long-term. They're the ground troops that go in and try to clean it up. So is that, everybody gets that? That's the difference. And then, of course, you could test negative. This is why they're so worried about these antibody tests. It isn't the positives they're worried about, it's the negatives. Because think about this. The body needs time to react to the infection. So everybody's different. So you just may not have developed enough antibodies yet when you're coming in for the test.
Okay, we are coming up on our first break of the morning. We're going to pick this conversation up. And certainly if you have questions about COVID-19 or testing or what Dr. Molly does at Innovative Medical, this is a good time for you to call in, 855-839-1210, 855-839-1210. The last couple of weeks, folks have been kind of paying attention. Call early so you make sure you get in. Don't wait till the end of the show, and then we can't talk to you. 855-839-1210. It's Health Watch every Sunday, 8 till 9. Talk Radio 1210, WPHT, with Dr. Molly Fantasia, the Ph.D. doctor and the executive director and the founder of Innovative Medical Associates. I'm your host, John DeMasi. We return. More of today's Health Watch after these words. And we're back. It's Health Watch. Operators standing by right now at Innovative Medical Associates, and you can reach them at 856-489-0505. And you may say, well, when I call them, what do I do? Well, you ask any questions.
Get a free consult.
That's right. Get a free consult with Dr. Molly. All you got to do is say, listen, I want to come in and talk to Dr. Molly. They'll arrange that for you. It's very simple. The initial consultation is complimentary. And again, the number 856-489-0505, 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. Couple of quick reminders on the website. You can now purchase the skincare products, correct,
That's right.
Dr. Molly?
That's right.
And also, where normally we have our Health Watch replay, but due to the station carrying NFL football,
Which is very important
that's
for
right.
your health.
We understand we take a back seat to the NFL. That's not a problem. But now our replay is, so you'll hear today's show next Sunday at 6 a.m. So if you're up, you want to listen to it, it's there. But we'll get back to our normal schedule after the holidays. Right.
After the
okay.
holidays. So,
right now, Health Watch here, 855-839-1210. Dr. Molly is here. We're going to wrap up this COVID thing.
So let's wrap this up in a few sentences, John. A negative IgM result suggests that the subject has not been exposed to the virus recently, okay? Their immune system is not showing evidence, all right, of fighting an active infection, okay? The IgG is positive, then we can assume that they've had a past infection and they may have some level of immunity. Some, but we don't know how much. And the test that I love is the antigen because it induces the response, the body's response to make antibodies, and it detects the proteins on the virus. So that's the best. All right, that's it.
Okay. All right.
All right. That's it for this. That's it for this segment.
I'm just going to say, you're a scientist, so this is like brushing your teeth
but
for you.
I tried to sum it up.
I know
Thank
you did.
you.
Okay.
Thank you.
All right.
Okay.
Let's talk to Frank in the Northeast. Frank, good morning.
Hi, Frank.
You're on with Dr. Molly.
Good morning, John and Dr. Molly.
How are
Morning,
you,
Frank.
sir?
Dr. Molly,
Yeah.
Christmas is this Wednesday for me because I have an appointment with the one and only Dr. Molly at 10 a.m. sharp. Woo-hoo.
Oh, good. I'm looking forward to it, Frank. I think my gal told me that. That's great.
Yeah,
Good.
I told her. I said, tell her Frank's coming. I warned you.
Thank you, Frank. Thank you. I'm very happy that you're
I
coming
can't
in.
wait, Dr. Molly. I've been listening to you for
Good.
a long time. I got copies of my lab results, MRI
Good.
on brain, C-spine,
Good.
thoracic
Yeah.
lumbar,
Yeah.
medication, and don't call out sick on Wednesday, okay?
No, listen. Let me tell you something. As I said earlier, you know, I'm testing my group every week. We start the week with testing for our people. So believe me, nobody's nobody's sick.
Don't have the case of sniffles or anything.
No, don't worry about it. Tell you, Frank,
Doesn't usually happen,
Let me
Frank.
tell you something. Let me tell you a secret, Frank. I would drag myself in there and make sure that I saw you because you're a great guy, and I know you've been suffering with this a long
I can't
time.
wait, Dr. Molly. Yeah,
All right.
And I was surprised this morning. I got you to 6 a.m. I'm having an overdose of Dr. Molly today.
Yeah, I know, but
Yeah.
It's just the way the station is running right
Hey,
now.
Dr.
But
Molly and John, it was
Yeah.
weird. It was a repeat from last Sunday, and I heard
Yes.
myself. It was goofy.
yeah, isn't it something, Frank? When you
Yeah,
hear
when you hear
yourself,
yourself,
on the
yeah.
radio,
It
it's
sounds
like
terrible.
a different.
I like it.
Yeah, it's an out of body. All right.
Yeah.
Well,
You
listen.
have a great day. I'll see you Wednesday, Dr. Molly.
Thank
All right,
you.
Frank.
Thank you.
And
That's
good
a
luck
great
with that.
call. That's a great
and
call.
certainly keep us posted.
God
on that.
bless you, Frank.
Yeah,
I'm glad he's coming in because he's called several times and he's got some challenges I'd like to deal with. Okay.
All right, 855-839-1210 if you have a question for Dr. Molly. I wanted to talk about, well, just to touch on what you've told me before the show. You go in early now. Talk about really being thorough, which you always are. You go in early and you do some of the sterilizing and cleaning yourself.
Well, not sterilized, but we do a spray. We have an antiviral spray for the thing.
Right.
You know, I've been running something called the room scrubber 24/7. You know, I have the people coming in to do the environmental cleaning.
Right.
Twice a week, maybe 3 times a week, depending on how many patients I have going through there. And what we do then is we follow up with the wiping down and that kind of thing. So every morning I'm in there about an hour earlier, and I gotta bless my lovely Linda too, who comes in as well. And we really make sure we're set for the day, set for the patient. So again, we are in good shape for this thing. And one of the things, but I don't want people who are just coming in, with all due respect, who say, I have the virus or I had the virus and I need this. I need to make sure that you don't have an active case. So I want to see your test that shows you're negative, period, end of story, okay? So it isn't that I don't want to help everybody. It's just that I can't.
We should also mention, again, you have constantly talked about the immune system and vitamin C.
Here we go.
And this is a big help. I feel, myself, that it's been a big help. And I don't really worry too much about it. Of course, I don't go out and I don't mingle. But I'm saying, twice a week I'm in there.
Well, you're not a hermit. I know that. Okay, so that's okay.
I'm trying to be.
Yeah, I know. But you know what, John? Here's the deal. Stress will do what? Stress will just start. Stress brain disrupts something called your neuroendocrine balance. That's your immune system.
Yes.
So, the more we're stressing about this thing, the sicker I see people. And I really would like to tell everybody, let's widen back. We all believe in the good Lord. And let's hope that if we follow good hygiene, you keep your immune system in check, we're going to get you through this thing the best way we can.
So the key is here, and not just vitamin C, but to do the best you can to keep your immune system, because that's, I guess, your best defense, right?
Listen, we have a vagus nerve that runs from top to bottom in us, right? And it regulates gut mobility, it pH, gut flora, and it connects to the brain and the limbic system. We need to control our emotions about this thing, because it then in turn makes your immune system go down. And there's only one way to keep your immune system up, John. That's to what? Have good nutrition, which is what the hydration does.
Right.
The vitamin and minerals. We give you everything we can, and we try to get control of your underlying medical challenge and keep your improved quality of life.
We're coming up on a break shortly, but I want to talk about pain, because I know that that's something that you help people with.
Sure.
In terms of dealing with that. And also a new patient that came in this week, a breast cancer patient.
That's right.
So we're going to talk about that as well. And certainly if you have a question or you have a challenge, as you just heard Frank, he's called for a few times, and now he's coming in to see Dr. Molly this week. So, if you have any kind of a medical challenge, whatever it happens to be, feel free to call in at 855-839-1210. 855-839-1210. The men's health situation
is moving along.
The
instrument
right?
was delivered today. We have in-service. We are meeting with physician and physical therapist, and we're doing an in-service on the 15th. We should be up and running by the 1st. And that's what I want. And actually, that one of the things I want to talk about when we come back is acoustical wave and pain.
And this whole men's health thing, this is going to be
a full program,
right?
Guys.
But it's not just those blue pills that we see on TV.
Not just blue pills. It's not just going to the doc and having him use the physical therapy wand on your private parts. It's going to be a full program looking at blood flow, which we use the thing I was cut my teeth on, EDTA and chelation.
Okay. Jim, we're breaking a little bit early, so I just wanted to let you know. And we got plenty to talk about when we come back. And certainly, we welcome your phone call at 855-839-1210, 855-839-1210. Our show is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT, with Dr. Molly Fantasia, the PhD doctor and the executive director and the founder of Innovative Medical Associates. I'm your host, John DeMasi. We're coming back. Plenty to talk about right after these words. Welcome back to Health Watch. Operators, as always, standing by when we're on the air. at 856-489-0505. That's the number for Innovative Medical Associates, Marlton, New Jersey. And if you call right now, you want them to answer some questions, they will be happy to do that. And most importantly, as you heard Frank say earlier, made an appointment to sit down with Dr. Molly, go over the issues and the situations that you have, and certainly you can get some information that you need at that point, and then you can make your decision as to whether you want to move forward. 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you try to listen to us this afternoon for our replay, sorry, it's you're going to hear NFL football. But we are on. Our replay is on now for the month of December. We're on from 6 a.m. till 7 a.m. every Sunday, or a Health Watch replay. Right now in the studio, 855-839-1210 is our number here on Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly, acoustic wave therapy, that's the what we're talking about here?
Yeah, acoustic wave therapy. I'm actually weaving it into our hydration protocols for pain. For example, I'm thinking about in the 10 treatment protocol that we have for pain management, I'm thinking about weaving this in on number 1 and 5, something like that, or 5 and 10. And what I intend to do is not just use the homeopathics and the things that improve blood flow to certain areas of the body, but this acoustical wave therapy actually works on things like plantar fasciitis, on shoulders, frozen shoulders, small joints. I'm actually going to be using it a lot for my chronic fatigue patients and fibromyalgia patients because I believe they have a lot of problems with their small joints. It can also work on trigger points. Now, you've heard trigger points. There are certain points along the body meridian, which is an energetic point, to help a patient through with their pain. I'm a big believer in doing this. So again, this is a new, a new facet to what we're doing, but it's in addition. But we never lose the old standby hydration.
That's right.
Hydration therapies and utilizing things that we know help improve blood flow, that we know will help people reduce their pain level just with the hydration as you've experienced. But this is going to enhance that, and that's what I want to do for my patients.
Well, I was just going to ask you a personal question.
Yeah.
That with my back problem and
Sure.
the pain in the back, is this going to be able to help?
It certainly can.
Okay.
And what we're going to do, again, along the trigger points in the facet joints, too. So that's the kind of thing we are going to look at. And, again, that's going to be in place after the first of the year.
Well, I can't wait. Because
Okay,
I'm looking
John.
for any additional help.
Yeah, and I think people are going to really like this, and I'm weaving it in with the hydration because I know without the proper blood flow to areas, it doesn't matter what we do. So again, hydration is so important, John. Nutrition.
Well, obviously, you've made a career out of this for
Amen.
24 years, right?
Yep.
The question I have, though, with regards to men's health,
Yes.
Is this hopefully getting them to potentially eliminate like the blue pill, the other pill, and all that
Yes,
stuff?
again, exactly the way I talk about other things. We want to reduce some of the side effects of those meds. Did you ever read the side effects on this or what you got to worry about?
I listened to the commercial.
Amen.
15 seconds on the disclaimer.
Yeah. And what I'm saying is this is a way to help. And also, I want people to know that the little blue pill is not a panacea in that, again, you need to look at as a patient appropriate for it. But if you come into a place like ours, our medical director can then help you get something like the little blue pill, but more specifically for you, and we'll know some of this after you're doing the treatments.
So it's sort of as always, it's a customized program.
Right, exactly. So imagine being able to have the active ingredient in the little blue pill in a dose that's appropriate to you, which may not be more, okay? It may not be more. If we open up the vessels, you may need much less. So then what don't you have to worry about? The side effects.
Right.
Here we go again. So it's really in keeping with the philosophy of what we do, John.
which is the least
amount of the pharmaceutical,
right.
Okay? But I'm not saying don't do it. And again, also, we want to look at your hormones, guys. I'm telling you, the longer I live, the more I know. A lot of guys, after the age, believe it or not, of 35. I have 2 very young guys right now. This is an interesting case. Now, there's not a lot of data on this, if there's any. This gentleman had COVID, and I found out he was having a really hard time, terribly fatigued. I run his hormone levels, and his testosterone is grossly undervalued. Grossly. I mean, like 20. And he's a young guy. He's in his 30s. Guess what? He went to the infectious disease guy who said, yeah, you know, Dr. Molly could be right because we are seeing hormonal fluctuations with the COVID virus.
And what are you doing?
We're giving him an appropriate dose of testosterone, and believe it or not, he's going to be in our men's program come January.
Okay, January 1st.
I would say somewhere in the first week of January, maybe the 5th to 10th.
Okay.
Yes.
And this is going to be this men's health program. Is this going to be like the hydration, 10 weeks, 15 weeks, 20 weeks? Okay.
Oh, yes. Oh, yes, because you've got to continue to do the hydration while you're doing this, or you might as well forget it. If we don't get global blood flow, forget about it, guys. You're only working on the localized, and that's not enough. It won't sustain you. And bottom line, I'm all about relationships. What about your women?
Right.
Come on.
Well, the women are certainly happy, and I'm sure some of them are going to call you.
Absolutely. Yeah, some of them already have,
right.
And that's the key. So, you want to do a program correctly. That's the point.
All right, 855-839-1210 is our number here in the studio, and we do have some open lines. So, again, still got plenty of time to take your calls. We have plenty of time left on the show, and we always don't like when somebody calls in. We like when you call in, but when you call in and we have 2 minutes left and we can't get to your call. So 855-839-1210 is the number, 855-839-1210. Is this acoustic wave therapy, is it going to help with all different types of pain?
Yes.
Okay.
Yes, and it's also, remember, the acoustical wave therapy breaks up broken blood vessels. It can do a lot of things, but it will be enhanced with the IV hydration. And again, with the specific nutraceuticals that can help depending on what kind of issue the patient has. That's the key.
Yeah, I don't have to tell you. I mean, there's a lot of people out there in pain.
Yeah.
And we don't have to talk about the prescription med thing and all of
I don't even, and pumps, pain pumps, and all
that stuff that has gone wild in the last couple of years.
Right.
So this would be a way to do it safely, right?
Safely, and cut down on your opioid use or whatever else. Look, I'm not saying it's a panacea, but it's certainly going to help, and it's going to actually enhance the outcomes of my hydration therapies, which have a pretty good outcome right now. So I only see this as a winner for my patients.
All right, we're coming up again on a break shortly, and after the break, we want to talk about this new patient
one of a couple
with breast cancer. But before we get to the break, can you just talk for a minute about the skincare products? I mean, they're now available on the website.
So John, we're hitting everything today.
Right.
But
End of the year, we got to get them all in.
But here's the deal, John. I don't want them to think Dr. Molly wears so many hats that she completely forgets about her chronic patients. I don't. We are a medically supervised. We are a medical hydration clinic. So let's go to the skincare. That came about with my good friend, Dr. Harvey Glass, who was a very well-known dermatologist and also a patient of mine. So what happened was he started looking at the ingredients I was using, and I love him because he also was a pharmacist. People don't know that.
Yeah.
He has a degree in pharmacy. So he was looking at these ingredients, and he said, Molly, you've got something here that is so fabulous in that you could really put together a skincare line. So we started studying this. I said, well, I've often thought of, and I told him a little bit about some of the protocol I had written down. He said, let me snatch those. And he did. He helped me actually fine-tune them. And as a result, we have a small line. It's not huge. It's about 9 products. But guess what? They're dynamite. They have the same powders that I use in the IVs, okay? So they're manufactured here, they're cleanly manufactured, and they're good for most skin types. In fact, they're good for all, as Dr. Harv likes to say. But I'm telling you, they are really good products. I'm getting a lot of good feedback, and you can order them off the internet. My patients are absolutely buying them in the clinic. Their wives are loving it. The guys have used several items. It's very hydrating. And again, the whole premise of these have to do with hydration. And remember, the skin is the largest organ. We're looking at collagen. That's the buzzword right now. My IVs enhance collagen. So the utilization of the ointments and the creams on the outside and using the IV therapies on the inside, you got a winner.
Okay, explain how people can get the innovativemedicalassociates.com, and
right.
Where do they go from there?
They look down for the store. I believe it's on the thing. It says store. Go into the store and you can get right over to them, and we get them out. And we get them out probably within 2 days of when you order them.
Yeah. Okay. 855-839-1210 is our number here in the studio. Health Watch is the show. Sundays 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. We have plenty of time left on the show to take your questions at 855-839-1210 with Dr. Molly Fantasia, the Ph.D. doctor and the executive director and the founder of Innovative Medical Associates. I'm your host, John DeMasi. We return more of today's Health Watch after these words. Back here on Health Watch, operators standing by right now, and don't worry, they'll be there after 9 o'clock when we leave you here. And they'll be there all day, all right? Operator standing by, Innovative Medical, 856-489-0505, 856-489-0505 is the number. That's the number today, tomorrow, during the week. You want to call Innovative Medical Associates, talk to Dr. Molly, feel free to do that, 856-489-0505. The website, you just heard us talk about skincare products. You can find them there. You can find a lot of good information on it. And it is always updated. InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com is the website. And don't forget our Health Watch replay for the month of December will be on next Sunday from 6 a.m. till 7 a.m. So you can listen to today's show then and then our live show. So, I mean, it's like you got a couple of hours of Dr. Molly and Health Watch, all right?
Amen.
855-839 is our number here. It is Health Watch every Sunday, 8 till 9, a live version. Talk Radio 1210 WPHT. Let's talk to Jackie in Tacony. Jackie, good morning.
Hey, Jackie.
You're on with Dr. Molly Fantasia.
Hi, Jackie.
Good morning, guys.
Hey.
This one.
That's my Jackie from our office. Good.
Yes, it is.
She's my patient, everybody.
To say how much I love the skincare line.
Jackie, tell them why, though.
I tell them why. I've been doing skincare for a very, very long time. I have used many, many different brands, and now that I'm using Dr. Molly's, my skin is glowing. And I'm in my 60s, and I do the hydration, too.
That's right.
And my skin is fabulous. And I get many, many compliments on it.
That's great. Hey, Jackie, I wanted people to know that you're a professional in this and that you're also a hydration patient in that we're, again, the reason why collagen production is extremely important, right? And these products, along with the hydration, I believe are helping you. But I got to tell you, you are a different person than when you first came to me. You've always been beautiful, but now you're not just beautiful, you're glowing, and you're healthier, I think. And you're healthier.
Oh, yeah, I remember. She wasn't in great shape when she came in.
Right? So I'm thrilled. I'm thrilled. And I also had the privilege of helping her daughter as well, who's young. Yeah. So again, we don't really, it's not just old heads that are sitting in our chairs. That's what I want. No. Jackie's fairly young, guys, by the way. So I appreciate it. Hopefully I see you tomorrow at the office, maybe.
Yes.
God bless you.
But the skincare, everyone must try.
Thank
Jackie,
you
thanks
so
a lot.
much.
Thanks a lot for the call.
Thank you. That was a great call, and she really means it. I mean, she is a professional.
Yes.
Yeah. So that's the key, And believe me, we didn't pay her to say this.
I know.
She pays me. So it's a good thing.
That's right. All right. Let's talk about this new patient.
Yeah. This
breast
cancer.
cancer.
Yeah.
This
58
is
years old.
This is a tough one. So let's talk about it.
Actually, I think I mentioned about a week ago that this patient had started.
Yes.
And I set up the consult with my wonderful consulting oncologist, who's in New York, by the way, who, of course, has a problem with COVID as well. So we did a Zoom, which I have to laugh because he and I both, we laughed because we're technically unsavvy. We ended up ending the session with a conference call, which worked out well. But he got to see the patient on the initial Zoom or the GoToMeeting. In between this, anyway, this patient has been suffering with cancer since 2008. So you can see already she's done pretty well. Youth is on her side. But, you know, it's a very, very aggressive breast cancer. So we went through everything that we can do and also what the good doctor in New York can do, and I believe that she got on board. But what was interesting about this case, and I want people to get it, she's been treated at a very large institution, and she was to go back there the day after our consult, and she did, and she got a ton of information both from the oncologist and myself. She goes back there, and she was treated with the same drug in 2008, then again in 2015. I'm talking about the chemotherapeutic. Now, we believe that you test for the genetics of the tumor, and we use a very specific laboratory for this because it not only gives us what's available, but it tells us what trials are out, and it looks for genetic markers that can allow the oncologist to go between categories of drugs, including immunodrugs, that are out for other cancers. Do you hear that? That
yes.
The tumor might respond. So, for example, everybody's heard of Keytruda, right?
Yes.
And they generally use it for small lung. But it's been known to work for some breast cancers, depending on the makeup. So these are the options. Well, she went back to her regular oncologist, and would you believe the oncologist said, oh, we could do that test? Well, my question, and I've been sitting in this since I spoke to her yesterday, by the way, Saturday, I said, well, isn't it interesting that they can do that but hadn't done it? Right?
Because
Think
you
about
mentioned it, right.
That's right, because she said we were doing it.
Right.
Oh, they got right on it. Oh, good. They should have gotten right on it in 2008, and I didn't know this woman in 2000.
Right.
By the way, just so you know, would you believe my nurse, Barbara, had already contacted the lab and had it in process even before she went back to the oncologist? Okay?
I would believe that.
Yeah, believe it. So my point is, folks, yeah, I hear the commercials. Where you go first counts. Yeah, it does. It does. And I'm telling you, you should be armed with all your information. When you come in and join our protocol, you are armed with the information.
And unfortunately, that doesn't happen at other places many times.
I would say no.
And here's a
because
perfect
you're stuck
example.
and I think that example was worth talking about.
Right.
Because it really also reiterated my confidence in the consultant that I send my patients to, who I use myself, and I'm telling you that's the way it should be done all the time.
Well, we should mention that, and you've never been against
chemos. No,
or you've never been against
any traditional
traditional facility or anything.
No.
But you've always given us information to point out some things where maybe they missed, or maybe
they missed.
Maybe they didn't want to do it.
They didn't talk about
Right.
it because it isn't that. And also, there's some new things in interventional radiology that were worth talking about. So the bottom line is, they said, "Oh, they can do all that." I'm glad. God bless her. I hope she goes there. I hope it's what she needs. I think, though, she wouldn't have had any of this information if she didn't come in and start with me.
That's right.
And my job is to keep her going through no matter what treatment. I have no charge on where she goes and what she does in terms of the conventional. But my job is to keep her as healthy as possible, her immune system as active as possible through this process. Right?
She is now a patient, correct?
Oh, yes. She's a patient of mine.
And will be a patient, but
for the HARVey nutrition.
Right. And you'll continue to help her with this.
Exactly.
Which is to her benefit.
Exactly.
Obviously.
I want to keep up her immune system.
But how many, over the years that we've been doing this show, how many times have we told stories like that?
Many. But
it's unfortunate.
This is very unfortunate. But the bottom line, John, is this. Look, you know how I feel. I have patients who don't want to do any chemo, any immune therapies, and then I have patients who only want to do what I do. But guess what? I also have patients who do all of that, and we help support their immune system through conventional treatment. It's really an individual choice. I have no charge on it. I'm not upset at my patient. I'm upset that you're not always armed with the information you need.
And you know what's a good holiday gift? Speaking of the skincare,
Yes.
that's a good holiday gift.
Absolutely.
Right? You get that for somebody. There you go.
Absolutely, and we're packaging them up very pretty.
That's right.
Yeah.
And that, of course, is going to put the wraps on another edition of Health Watch.
I have more
Sorry.
to talk about, John.
I mean, you got more. Listen, save it for next week, all right? Don't forget, if you want to contact Dr. Molly at Innovative Medical Associates, 856-489-0505 is the number, 856-489-0505. Operators are there now, and they'll be there after we leave you at 9 o'clock, and they'll be there all day. Oh, we got to, that's right, we got to put her in there too. Okay. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, let's start with Joanne, okay, who takes care of the books and everything else and helps wrap the skincare and whatever, all right? The lovely Linda, Barbara, delightful Dee, fabulous Fran, and our nurses Jess and Crystal, and our medical assistant Kathy. I'm your host, John DeMasi. Thanks for listening. Have yourself a great week and a safe one. We'll do it all over again next Sunday, 8 a.m., the live version of Health Watch, Talk Radio 1210 WPHT. You take care.